patients need much more than medical care on their healing journey. Their emotional well-being and psychosocial health deserve just as much attention because cancer afflicts the body and alters lives in different ways for different people. This is where Can Hope, a non-profit cancer counselling and support service by Parkway Cancer Centre, makes a difference.
What we often forget that in the treatment of any patient, it's not just the patient's disease and physical state that we need to focus on, but also in terms of the emotional needs of the patient. And that's why it's so important for us to work with our counsellor, the dietitian, with the nurses and so on, in order to encourage patients. And that's why Can Hope plays such an important role.
Cancer is not a death sentence. And at Can Hope, we try to reach out to patients to lend support, and give encouragement and inspiration so that they can fight the disease and be more cheerful and hoping for a better tomorrow.
When patients come with cancer or they think that they are having cancer, they're so scared. They don't know what to do. So what we do in office is try to guide them, try to help them to think what to do.
One of the oncologists, local oncologists, gave us a call.
Hello viewers, this is Dr. Sian signing in today's Doctor's Voice episode from Singapore Mount Elizabeth Hospital. Our today's topic will be oncology, especially breast and gynecological oncology. We will discuss about this with Dr. C. Hui Thi. Hello Doctor, welcome to our show.
Hello, thank you.
Dr. C. Hui Thi is a medical oncologist with special interest in breast and gynecological cancers. She obtained MRCP from UK, fellowship from Edinburgh, Scotland, and was trained in Texas, USA. Currently, she is practicing in Parkway Cancer Centre in Mount Elizabeth Hospital, Singapore. So, Doctor, what are the common cancers you face, especially in case of gynecological cancers? What are the common cancers a patient you find?
I think in Bangladesh, the most important female cancers are breast cancers, cervical cancers, and ovarian cancers.
Ovarian cancers.
Yes.
So what are the risk factors for a patient for getting breast cancer?
Breast cancer, the major risk factor is actually obesity.
Obesity.
And family history.
Okay. Is there any other risk factors which can be modified or more modifiable risk factors others?
Actually, there are only a few risk factors that we can ourselves and ladies in Bangladesh can overcome. Because first of all, we know that ladies in Bangladesh don't smoke, they do not drink. So these two risk factors are not important. What is more important is that we must control our weight and we must exercise. That can really reduce the risk of breast cancer.
Okay. So usually how the patient of breast cancer presents to you?
In Bangladesh, most of the patients present with a breast lump.
Breast lump.
Yes.
Okay. And any other associated features like weight loss or something else?
Usually it's not, because breast cancer has to be very advanced before it causes weight loss. So majority of patients are normal weight or heavy weight.
Normal weight to heavy weight. Okay. Is there any role of hormone replacement therapy in developing cancer? Is it a risk factor for breast cancer or other gynecological cancer?
It's actually more common for ladies who are premenopausal to get breast cancer in Bangladesh and in Singapore, the Asian population. So the commonest age group is between 40 to 50 years old. So these are ladies who are not on hormone replacement therapy. So I do not think that there is a link in Asia for patients who are taking hormone replacement therapy in getting breast cancer.
So what are the treatment modalities for a breast cancer patient?
I think first of all, people must not fear. This is a cancer that is very treatable. We must first diagnose it with either a mammogram or an ultrasound, and then surgery may be offered. After surgery, we can eliminate cancer by reducing the risk of the cancer coming back by using chemotherapy, radiotherapy, or oral medication.
Okay. So the diagnostic modality, first-line diagnostic test is mammography.
Yes, there are two. There's the mammography as well as the ultrasound.
So the diagnostic modality is mammography, and for ensuring histology or the type of cancer you go for?
Yes. There are many different types of biopsies that are available. There is the fine needle aspiration biopsy, and there's also the true cut biopsy, there's also the open biopsy. Okay. There's also this thing called the mammotome biopsy, which is very advanced, and patients can have actually removal of the entire lump without actually undergoing general anesthesia. I think most of my patients who come with a small lump, smaller than 1 centimeter, I would refer her to see a breast surgeon who would then do that. I personally do not perform any mammotomes.
Okay. Okay, doctor, we'll get to know about other cancers as well after a
Yes.
short break.
Yes.
Dear viewers, we are going for a short break. Stay with us.